Southern Plains Medical Center presents your hometown medical minute, and your host, Al Brock.
Hey everybody, happy Friday and welcome to our podcast, Your Hometown Medical Minute. I'm your host, Hal Brock, and with me as always, behind the cameras, our IT director, Mr. Ed Harrison with us. So we've upgraded, still no camera, so you're not going to see him today, but you've got a fancy smancy headset on, Ed.
Yeah, you should be able to hear me a little better now.
So see, last week when we did it, your hey sounded like you were like a million miles away. So this is going to be neat. So hey, it's St. Patrick's Day weekend is this weekend. Happy St. Pat's. And, you know, a lot of Irish history here in Oklahoma. In fact, my tribe, I'm a member of the Choctaw Nation, and we definitely mixed with the Irish. In fact, Chief George Harkins is my family, and so that's a large Irish influence. So definitely looking forward to celebrating St. Pat's Day here in Oklahoma. A lot of history here, Ed, at Southern Plains. We actually started in Chickasha about 104 years ago. Getting close to that date, we're going to be celebrating that this summer with our team. March is National Women's History Month, which, man, we are riddled with it. We've actually had some amazing trailblazing women. Want to talk about them real quick, Ed, because Dr. Linda Johnson, literally one of the first graduate women surgeons in the state of Oklahoma, was here. Of course, Dr. Har, general surgeon, Dr. Deaver over in women's health gynecology, and Dr. Maloof. And then, of course, all across our organization and leadership and nursing, lab, billing, you name it. We are just full of very strong, powerful leaders, women leaders, and couldn't be more proud and grateful for their leadership. So happy National Women's History Month. And, and today's kind of a cool show. Of course, Southern Plains, it's growing. A lot of moving parts. Just here in Chickasha alone, 17 medical specialties under this roof, a fully CLIA-COLA certified wave lab. Of course, we met Corey Couch Imaging to include an open MRI right here in Chickasha, one of the only ones in Southwest Oklahoma, and then clinics throughout Southwest Oklahoma, Maysville, Anadarko, Pauls Valley, a couple locations down there. And so actually, if you don't have insurance or you're underinsured, you have a large deductible and you're paying a large monthly premium, not actually using your product, Southern Plains also created a one payment a month model. So for $100 a month, we give you unlimited access to about 85% of all healthcare that you need. And that program is called SPMG Health Pass Plus. It actually would allow a patient to come in, see our urgent care, quick care department, no appointment necessary. You walk in, you'll be seen in minutes. Then you could be sent down, get labs, go over, have an open MRI. Hey, look, the average cost, according to healthcarebluebook.com in Oklahoma City, for an MRI is near $2,000. So a patient could literally, urgent care, come in, get an MRI, have labs drawn, go over and see an orthopedist in an outpatient setting, walk out without getting an additional bill because they paid their $100 membership at the beginning of the month. It's a phenomenal service. We're very proud of it here. Here to talk about that program a little bit more in depth is Yami Nygaard. Yami works down in our billing office as well. She manages our membership program, SPMG Health Pass Plus. So Yami has a background in education in business, has been here for a little while, does a wonderful job, and she also is bilingual, and she always goes above and beyond, is always willing to help in translating services. So if you ever need assistance, we're more than happy and able because of Yami, and literally, and you can attest to this, literally maybe the nicest person on earth. So without further ado, ladies and gentlemen, Mrs. Yami Nygaard. Hey guys, so Yami Nygaard is in the building. Yami, hello, thanks
Hi.
for joining us.
You're welcome, thanks for having me.
Absolutely. So Yami here works at our billing office, and she also manages Health Pass Plus, which is what we've just been talking about. Mm-hmm. But before we get to that, I want to know just a little bit about Yami. So, if you wouldn't mind, Are you from around here? How'd you get into healthcare? And how did we get so lucky to get you here?
Well, gee, that's a lot of questions. That's loaded.
I know, right? Well, I figured if we just threw it all at once,
that's right.
then I could just have you talking.
That's right. So, for starters, I'm not from around here.
Okay.
I'm a transplant. I'm originally from California.
Oh, wow.
Yeah, I've been here about 3.5 years now.
We're in Cali.
Los Angeles, the heart of it, of course.
That's so cool.
Everything is a little fast-paced over there.
Yeah.
So moving out here was probably one of the better things I ever did. It went from chaos and,
Right.
you're just going, to finally just living.
Right.
And
Yes.
you get to just take a deep breath and enjoy your surroundings, which to me was a blessing. You know what I mean?
No kidding. Mm-hmm. That's super cool. Well, we got extremely lucky, and so you came directly from California to Oklahoma.
I did, and I came here originally and applied here first.
Okay.
Got the opportunity to get hired, but then the employer I was with kept me a little bit longer.
And of course they did.
course,
Because
right?
I'm telling you, I would never let you go. I mean, I would
thank you,
fight
thank
tooth
you.
and nail to keep you here.
Thank you. That's awesome. I love being appreciated. So
Yes, yeah.
that's wonderful. So when I finally got the opportunity to work here, I took it, and let me tell you, it's been the best decision I ever made. I love it. I love what I do. I love where I started, and I love where I'm going. This is a place where I can see potential growth.
Absolutely.
So I love it. I mean,
Well, let me tell you, wherever you go, your potential for growth would be there in
Thank
any
you.
organization.
you.
You're simply amazing. You do so much for all of us, specifically for me in Health Pass Plus. Having an in-house billing office is such a luxury.
it is.
It's so nice, and because we actually just went over our numbers today, and we looked prior to having an in-house billing, and what you guys have done,
Oh, yeah.
just short of phenomenal. And that's really important. I don't think patients realize what you do affects them. Because that's, the big part of healthcare right now, and what everybody's screaming about is it's so expensive.
It is. Healthcare is ridiculously expensive. You're not only dealing with the premiums that you're paying on a monthly basis, but on top of your premiums, you've got deductibles that you need to worry about. And on top of those deductibles, you've got co-insurances.
Right.
And a lot of the times people don't understand the difference between what's a deductible, what's a co-insurance. How do I know what you're billing me for?
Right.
So having an in-house billing team has probably been one of the most beneficial aspects, by far, because we have the ability to talk to to our patients and explain to them, hey, you happen to have this particular insurance. The reason why you have this bill is because you have not yet met your deductible based on your explanation of benefits, or what we
Wow.
call the EOB. So it helps us to connect with our patients aside from just the front desk. But the billing department plays a big role in that, because
Huge.
if we can explain why you have a bill, then for sure 100% certainty this is what I'm being billed for. Or if there's a discrepancy or you're not sure of, you can contact us instead of having to contact somebody outside of here who may not know what's going on.
For sure.
So it's a blessing to have it, really.
It really is, and especially because of what you just listed off. I still didn't understand half of the concepts that you mentioned, because health insurance, what I've learned in healthcare, it's extremely confusing. Now, I don't think, I think some parts, just like in any business, there are some that is out there maliciously, but there's some because of the changes that took place in 2010. Some good, some bad, detrimental, and confusing. But yeah. I don't co-insurance, deductible, out-of-pocket max, out-of-pocket expenses, stop loss, copay. It's nice to say, oh, I have an insurance and I'm covered, but are you?
Well, see, that's where you're kind of iffy, depending on what insurance you have. But realistically, the insurance companies aren't there to. I hate to say this, but they're not really there to help you.
Right.
They're there to make a profit.
For sure.
So, most businesses would be. You can't blame them for trying.
Right.
But when it comes to the point where they're making more of the profit, and you, as a consumer, can't utilize the services that you need properly because it's too expensive.
Yeah.
When you have a deductible of $4,000 and you're paying, your premiums on a monthly basis, whether that be for an individual or a family, you're talking like between $180 to almost $2,000, depending on the family size.
I haven't seen that many of those 180s.
Oh,
I think the average in
rarely.
Oklahoma for an
very
individual
rarely.
is $500 to $600, and for a family is $1,200, which in Oklahoma, $1,200 a month
That's a lot.
pays a mortgage,
Yes.
pays your B&I
Oh,
insurance.
gosh, yes.
You know what I'm saying?
Oh, yes.
And, and again, the insurance companies, and back in the day, insurance was for those major catastrophic incidents.
Exactly.
And to a certain point, it still kind of is. Now, I think we've gotten so used to thinking, oh, we've got this copay, it's going to pay for everything, but in reality, it doesn't.
It doesn't work that way, unfortunately.
Right. So a lot of places have been pivoting, and you have to, in this healthcare landscape, you have to find what's working, what you can do, and we've got to create access. And that's what Lynn Lacefield, our CEO, it's what his whole mission has been. That's what we're down here doing, creating affordable and accessible physician consults. And so we ran about 120,000 patient encounters, analytics, and we took what our patients use, what they go and see, and then we ran those, and we wanted to see if we could do a direct primary care.
Okay.
But we wanted to expand that, and we wanted to encompass specialties.
Absolutely.
And that was the birth of SPMG Health Pass. So can you, and you're the manager of SPMG Health Pass.
I am.
And you keep up with a lot of members. I mean, it's approaching, 1,000, 500, 600 members.
Yes.
And so you're managing, and what's cool is a health membership, you kind of get to manage the whole patient and treat them throughout 17 specialties.
Absolutely. I think for the most rewarding part of being able to manage Health Pass is being involved in it from the very beginning.
Yeah.
So I got to see it as a baby, in a sense. And we got all the growing pains, and we got it set, and it's finally a well-oiled machine that's working, and it's getting the results that we love, So it's being able to talk to the patients, not just, a phone call, but I mean, face to face.
Yeah.
Answering the questions, explaining to them anything that they may need. I mean, it's like you said, it's all encompassing. It's not just, okay, sign here. I mean, just today I have the privilege of walking a patient through step by step the contract itself, because it is a contract, as we said, a membership.
Okay.
And I mean, it's so rewarding to be able to take that and say, hey, you know what? You are now covered. If you need to be seen, walk with me. I will take you where you need to go.
That's so cool.
And just that whole experience from beginning to end.
Yeah.
And the patients appreciate that. She said, "Oh my gosh, thank you so much. I'm so grateful." And to me, that's really what it's about.
For sure.
It's the full experience. It's not just, okay, I'm covered. It's not an insurance. It's a membership. And as a membership, with membership come privileges. And some of those privileges, are, hey, if I need someone to talk to, let me call Yami, or let me call, one of the wonderful receptionists that we have. And if I have a question on some, we're accessible.
Yes.
Whereas some of these insurance companies aren't.
Right.
So
Right.
That's that personal touch that I love so much about the Health Pass program as in whole. You know what I mean?
Well, you're the perfect person to oversee the program. And to digress a little bit and to kind of explain, direct primary care is where a single physician would accept patients unbounded to an insurance. So it's kind of like paying cash, except it's a membership. So like you have Sam's Club, you pay a membership, you can go shop at the store. If you don't pay the membership, you're making other payment arrangements or shopping elsewhere. So family care practitioners were going, and they're paying $50 to $150, and they were able to see that one provider, and then maybe 2-3 visits a month. But you're limited. You're limited to one specialty. You're limited to family care. You're limited to whether they have laboratory, whether they have imaging or not, and that's something that direct primary care missed for me.
Yes.
So what We Plus allows for not only just primary care, but it sets up for urgent care, internal medicine, pediatrics, gynecology, women's health, because Dr. Deaver, and so Dr. Deaver actually does kind of family medicine and women's health, gynecology. It's really cool. Chronic disease management. So again, Health Pass Plus, the more membership, what you were talking about is more of treating wholly and like preventative medicine.
Exactly.
So like diabetics and things like that can come and see Dr. Malouf on a regular basis, for this $100 a month, which is incredible.
Yes, it really is. I mean, where else are you going to get service? Not just primary care, but like laboratory services and radiology. I mean, these are things that are covered with Health Pass.
Yep.
I mean, it's not just, I'm going to go to the doctor, and I mean, with everything, because it is a membership, it covers about 80 to 85% of your medical, not 100%, unfortunately.
Because we don't have a hospital.
Exactly.
So it's not for any inpatient.
No,
it's
absolutely
not for major medical. So, if you break your arm, your surgery is not going to be covered in this. So, you would want to have an insurance, or we have up in Oklahoma City, Dr. Keith Smith, very transparent in pricing. You can also go up there. But what will be covered is when you do break that arm, you need to go to an urgent care center. You can come in, walk right in. You'll be seen in minutes, and then you'll be sent down to our imaging, get a digital X-ray, an MRI. We can find out where the break is, find out if there's any tendon damage or anything else.
Exactly.
We could draw blood, see if there's any infectious disease based on the injury growing, which is really cool. All of that would be at no additional cost if they paid the $100 a month.
Correct.
So also general surgery, orthopedics, so the orthopedic consultation,
The consult, correct.
lab, vision services.
Vision services.
So optometry.
Vision services.
Right.
How awesome is that? It's not just primary care, folks. I mean, we're talking vision services. You can go get an eye exam
Yes.
with one of our wonderful doctors. And we have a vision lab
Yeah.
that can make your glasses in about an hour, give or take.
Like the big little stores, you know?
I mean, and it's customized to you. So it's like I said, it's about the experiences.
Yes.
It's not just the fact that, oh, I've got my primary care. I guess you can want to compare it to a family experience. You want to come in,
Yes.
and you want to be treated well, and you want to be, looked after.
For sure.
This program, I mean, aside from this program, we do that anyway.
Yeah.
But this program gives you that little bit where, I mean, you can get a vision exam at no cost to you.
Our vision exams, so I actually don't do traditional insurance because of Health Pass. My family's a healthy family. I've got a 4-year-old boy. We do all of his well childhood exams. I'm not an anti-vaxxer. We vaccinate.
Right.
I believe in medicine. I'm a Rotarian.
That's right.
I've seen what we've done with polio, so it's not that. But if we go, I pay cash or I'm on Health Pass because I'm not
Exactly.
going to the hospital. So we save
Exactly.
$1,200 a month.
Absolutely. I mean, that's a big savings.
Yes.
And I mean, the beautiful thing about the program itself, there's people who say, well, I've got insurance. Okay. We talked earlier about deductibles,
Right.
co-insurances. That's all stuff that usually you have to meet before the insurance just actually starts to pay out of their own pocket.
So you could actually use this to kind of cut off the cost of 90% of healthcare is done in an outpatient clinic.
Absolutely. I mean, we've got plenty of people who have both private insurance and Health Pass combined. Why? Let me tell you why.
Okay.
It's very simple. I mean, it's almost common sense when you think about it. I've got major medical.
Okay.
My deductible's almost $4,000.
Right.
Guess what? I will never, unless I get into an accident, God willing it doesn't happen, exactly,
There you go.
knock on wood, I'm not going to use that.
How often has that happened?
Exactly.
When's the last time you checked into a hospital?
Gosh, well, I must have been, 2009 when I had my child.
Oh my gosh.
That's how long ago it's been.
Wow.
So really, I don't have a use for it.
No.
But the beautiful thing about having my insurance and Health Pass combined is that if I come to the doctor, I don't have a copay.
Right.
I don't have a deductible that I have to pay out of pocket. So if my deductible isn't met come January 1st of the new year,
Right.
Whatever the insurance doesn't want to pay, because they send it and they won't pay anything because my deductible's nowhere near being met.
Okay.
So it's going to come to patient responsibility. Me. It's going to come out of my pocket. With Health Pass, I don't have to worry about that. And if I come to the doctor once, if I come to the doctor 2 to 3 times, that's fine. And another beautiful feature that I don't think we talked about yet that's included in that is the video visits. If you can't make it in, you have the ability to use your phone, your mobile device, your computer, and get a hold of a provider and say, hey, I can't make it in. These are my symptoms. This is what's going on. It's the virtual way to go.
Hey, and let me tell you, that program is about to be a little bit more robust. We're in a pilot project down here with a company called iMed Delivered.
Absolutely.
And what that is, it's a 24-hour-a-day, 7-day program telehealth platform that's unbound to insurance. So it's just $4.95 a month, unlimited phone calls. We're about to put that in Health Pass and just what they're already paying.
Exactly. So it's going to be combined. I mean, it's a beautiful idea to be able to pick up the phone. And from what I understand from iMed, it's not just the video visit.
Nope.
It's the ability to pick up the phone and, hey, I'm going to send you a picture of this because this looks funny.
Yep.
And that's amazing because it is virtual most of the times. You need to have that one-on-one face contact.
Right.
Well, if you're not able to do that because, we live in rural Oklahoma.
All sorts of things, for sure.
The internet isn't as reliable to some folks as it is to others. The ability to have that
Talking suddenly.
exactly, you know. No, that's true. I mean, that's how you do it. We live in a time period where we're moving forward with the time.
Yes.
Unfortunately, not everybody's ready to do that. But with it, I mean, people can use a phone.
Yep.
And if that's what you need to do, then you do it with that IMED program. Combined with that, I mean, that's going to be amazing.
It's going to be big for
Yeah,
people.
it's going to be amazing. If you can't make it in, because, you know, sometimes we have those moments where we just can't get out of the house.
For sure.
Doesn't mean you can't be
We all
treated.
have children.
Exactly.
Have you taken a screaming child to a doctor's office when you're the one that's sick and then maybe they're getting sick? It's not that much fun.
It's not fun. It's not fun.
Hey, so yeah, you mentioned so many great points. I mean, and so we can even give them a HICFA form. They can turn that into their insurance. Maybe their insurance will apply it to a deductible. Definitely will their out-of-pocket expenses. But you mentioned things like vision. Vision's typically a separate insurance.
It is.
So that being included in this, you can come and get a vision exam.
Oh, yeah.
No cost. You can then go and we give them a free pair of glasses as long as we make the lenses because we have the lab.
Correct.
So again, this program is for in-house stuff, covers about 85% of
Absolutely.
healthcare. All for $100 a month for primary members and then $75 a month for secondary.
For secondary,
members.
absolutely.
Pretty cool program. Okay, and so we, I know I've kept you here a long time. And you're a super busy person because you do manage Health Pass, but then you're also in our billing department. You guys are rock and awesome. But, so without revealing any names, and you've already kind of told us some examples, at least walking them through the deals, but I've seen Health Pass work in the fact of driving down costs for patients. Do you have like a scenario that you could maybe talk
gosh, I've got so many, to be honest.
Okay,
with you.
cool.
That's one thing I love about the Health Pass is, I mean, when we first started the program, I was working reception. So yeah, I got to see the numbers quite a bit.
Yeah, you did.
When you're looking at a self-pay sheet that reflects labs that need to be done,
Right.
and the office visits of a specialist, because, you know, those get pricey, and you're looking at the patient themselves not feeling well. When we're talking, I think the most expensive one that I've seen was close to $1,100.
$1,100.
$1,100 of self-pay. I don't know about you, but I can't fork that over.
No.
You know what I mean? So that's one opportunity that Health Pass is wonderful in.
Yes.
It's $1,200 a year for one, you know, for the primary member.
Right.
So in one visit, they practically paid
whole
for
thing.
the entire year. And they're still able to, you know, come back and use it. So that's, I mean, that was one example. I've seen a lot of them, and that was probably the most expensive.
Man.
But when you're talking, I mean, even orthopedics,
Yeah.
you know, we do have the consult, and sometimes that consult can run up when you're talking about MRIs, you're talking about, you know, just in general, lab work sometimes, because you don't
Lab's
know if there's an
expensive.
infection. Oh my gosh, yes it is.
And you had mentioned earlier about the insurance companies. It's nice to have that feeling of paying the copay and not having to pay anything else. But you will likely get a bill. And
yes.
moreover, that's where people get caught on medical bills, because a lot of times they think, oh no, my insurance is still going to take care of it. When in reality, no, that's the bill. Your responsibility. Your insurance is already, we've already talked to them. We've
Yes.
tried to get your insurance to cover it.
Yes.
They're not going to. And so now, unfortunately, the insurance company is going to bill you. And so you mentioned that, which is just, you know, it's hard.
It is.
Yeah,
It
it's hard,
is.
and it's hard on patients.
Absolutely, especially when people are on fixed incomes.
Yeah.
It makes it more difficult because you're putting your faith in these insurance companies that are going to, you know, pay. You're
Yeah.
paying your monthly premium, however
Right.
much it may be. You're expecting them to do their part. And oh, lo and behold, they didn't really tell you how the deductible works, because without you meeting your deductible, they're not going to pay anything.
Right.
So it's all of your responsibility until you get that met. So yeah, it's tough out there when you don't understand. That's why I said I'm very grateful that I work in a billing department
Yeah.
that takes the time to explain that to the patients. I mean, 9 out of 10 times, just knowing is half the battle, because
Absolutely.
at least you know what you're dealing with.
Absolutely.
You know, so yeah, it's a blessing to be able to be there, because I get to not only talk to these patients, but working with Health Pass directly as
Yes.
well. It gives me the opportunity to do the face-to-face, and if they do have any questions, I'm available. Absolutely. I'm also bilingual, by the way. Hablo español.
Yes.
So that's a beautiful
Amazing.
fact. Yeah, beautiful
Oh my
fact.
gosh.
So we can soar. This program is one that I wholeheartedly believe in, and I did from the beginning, and I still do, because it's helping so many families who can't afford the medical insurance and the deductibles and the co-insurances. It's a one set price, and you're good. I mean, you're good.
And that's why you're the perfect person and have driven this program and have just done such a wonderful job for this program. And I too, I've seen the benefits for people. You know, I've seen people walk in to an urgent care clinic and you know, that typical visit based on Healthcare Blue Book, you're going to be paying about $150 to $185 if you're a cash paying patient.
Yes.
You add on a CBC, you add on a couple labs, and now you're looking at about $200 for a 3-set lab, about $205, and so now you're up to about $400. And let's say you did have to get a digital X-ray, if that place had it.
Right.
Now you're looking at about $75 to $150 cash, maybe $50 sometimes. The new digital, though, they're trying to raise the price, and it can get tough.
Oh, yes.
MRI, Blue Book, $1,200. So all that's covered under your program. Yami, you've just done such a wonderful job growing it. I could literally have you here and talk to you all day because you're a wealth of knowledge. Holy cow.
Thank you.
Healthcare is so confusing.
It is.
It's gotten to a point where it's real hard. Our goal here at Southern Plains is to make it more affordable, more accessible, and with people like you, we're able to start doing that. Thank you so much for all your efforts.
Thank you.
You also mentioned that they could get in touch with you if you had questions.
Oh, absolutely.
Can you? Yeah.
If you have any billing questions in general.
And I'll put it on the ticker down here.
Yeah, we've got, you can contact us here directly at the regular SPMC number, which is the 224-8111, extension 2545.
Okay.
If you'd like to get a hold of me directly, if you have any questions about Health Pass, you can contact me. My direct extension is 1555.
Yes, it is. And because I call it all the time, because she helps me literally. If I didn't have you, I could not function in my job.
Thank you, Hal. I appreciate that. That means the world.
Literally the nicest person in the world. Thank you so much for being
here.
Thank you. Okay. Cool. Hey, thanks so much for joining us today. And come back next Friday and every Friday here on our Facebook page or over on our YouTube channel for your hometown medical minute.